All right, so today we're going to be taking a deep dive into medical tourism in India.
Okay.
We've got this really interesting YouTube podcast script that kind of breaks down all the reasons why India is becoming like a huge destination
Right.
for affordable and really high-quality healthcare.
Yeah.
I'm sure a lot of our listeners are already pretty familiar with the fact that it can be cheaper
Yeah.
to get healthcare in other countries, but
Yeah.
we're going to kind of go a little bit beyond that today.
Absolutely. I think what's really fascinating is how India is able to offer these
Yeah.
incredibly low prices without, cutting corners.
Right.
It's not just about like lower wages or anything like that.
Right,
It's a whole system that's kind of designed to keep healthcare
Yeah.
affordable and accessible,
Yeah, that's what I really want to like unpack today.
Yeah.
Give me the specifics. The script mentions
Yeah.
heart bypass surgery and how it costs
Right.
a fraction of the price in India compared to, let's say, the U.S. But how do the hospitals themselves actually compare?
Oh, we're talking top-tier facilities here.
Okay.
Apollo Hospitals, Fortis Healthcare Manipal Hospitals.
Okay.
These are names that you'll see mentioned alongside,
Right.
the best in the world. And a lot of these hospitals actually hold JCI accreditation.
Okay. Yeah, I've heard that term before.
Yeah.
But break that down for me. Like, what does that mean
Yeah.
for somebody who's actually considering getting treatment there?
So basically think of it as like a global stamp of approval
Okay.
for quality and safety.
Got it.
The Joint Commission International sets like really high standards.
Yeah.
And hospitals have to go through this rigorous evaluation to even get accredited.
Okay.
So for you, the listener, it's like a really solid indicator that, regardless of where this facility is, it meets those international benchmarks.
That's really reassuring.
Absolutely.
Okay, so we've got the facilities. What about the doctors themselves?
Right.
We're not just talking general practitioners here.
No.
India must have specialists
Oh, yes.
who can handle, really complex procedures.
Absolutely. India has a huge pool of highly skilled
Right.
medical professionals, and a lot of them have actually trained or even practiced
Wow.
in some of the top institutions in the U.S., the UK, Canada.
Oh,
They bring all of that international experience back home.
right.
And this is especially true for like really specialized fields, cardiology, orthopedics, oncology.
Okay.
These are areas where India is really making a name for itself.
So you could potentially have a surgeon who trained at Harvard
Exactly.
performing your procedure,
Yeah,
but at a fraction of the cost that you would pay in Boston.
exactly.
That's a pretty compelling argument.
Yeah, it really is. And, it's not even just about the cost.
Right.
The script also highlights shorter wait times,
Okay.
which can be a major factor,
Yeah.
Especially for those who need urgent care.
Right.
Imagine needing like a hip replacement. Yeah.
And then you're stuck on a waiting list
Oh, gosh.
for months, maybe even a year.
Yeah.
In India, you could have that same procedure scheduled within weeks,
Wow.
sometimes even days.
That's got to be a game changer.
Oh, absolutely.
Especially for something that is really time sensitive, like cancer treatment or transplant.
Right.
But let's move beyond the kind of conventional aspects here.
Okay.
The script mentions this thing called holistic healing.
Yes.
And that's something I'm really curious to learn more about.
So India has this long and rich tradition of holistic medicine,
Okay.
particularly Ayurveda. And it's not about replacing Western medicine.
Right.
It's about kind of integrating these ancient practices
Got it.
to enhance the healing process and your overall well-being.
So I'm picturing someone recovering from surgery in this super serene setting, and they're maybe incorporating yoga and Ayurvedic therapies into their post-op care plan.
Exactly.
It just sounds like a completely different experience than what we're used to.
Yeah.
You could be recovering on the beaches of Goa,
Wow.
receiving Ayurvedic massages, practicing yoga, maybe even exploring ancient temples,
Okay.
all as part of your like healing journey.
Wow.
It's not just about treating the ailment, it's about restoring the whole person,
Yeah.
mind, body, and spirit.
That definitely paints a vivid picture.
It does.
Okay, this is all sounding incredibly enticing,
Yeah.
but I'm sure there are some downsides, or at least things to be aware of
Yeah.
before you just pack your bags and head to India for treatment, right?
Absolutely. I mean, it's not like booking a vacation.
Wait, this is your health we're talking about.
Exactly.
So what are some of the key things
Yeah.
that people should consider?
I think, first and foremost, thorough research is absolutely crucial.
Yeah.
Don't just go with the first hospital you find online.
Right.
Look for that JCI accreditation.
Mm-hmm.
Read patient reviews.
Yeah,
Maybe even reach out to some past patients if you can.
that makes sense. And I imagine that language could be a barrier,
Yeah.
especially when you're discussing these really complex
Right.
medical procedures.
While English is widely spoken in India,
Yeah.
especially in those hospitals that cater to international patients,
Yeah.
it's always a good idea to confirm
Right.
what you're going to have clear communication with the doctors and nurses.
Right, because misunderstandings can have
Absolutely.
some pretty serious consequences when it comes to healthcare.
Oh, absolutely.
Absolutely. And what about like cultural differences? Are there things that we might not even be thinking about
Yeah.
that could potentially impact the whole experience?
Definitely. India has a really unique culture with different customs and
Yeah.
social norms.
Yeah.
Being sensitive to those differences,
Oh, yeah.
being respectful of those traditions. It can just make the entire experience
Yeah.
so much smoother and more pleasant.
It's all about being a mindful traveler,
Yeah,
even when the reason for travel is medical.
Right.
The script doesn't really touch on this,
Okay.
but I'm curious about the financial side of things.
Yeah.
Let's say I find a procedure that's, half the cost in India.
Mm-hmm.
Are there any hidden expenses that I need to kind of factor in?
That's a great question.
Yeah.
The lower cost of treatment is definitely a major draw,
Yeah.
but you have to remember there are travel expenses.
Right.
There's accommodation costs.
Yeah.
And potentially even visa fees.
Okay.
Plus, the cost of living can really vary depending on where you're staying in India.
Yeah.
So it's really crucial to get like a comprehensive breakdown of all those potential expenses before you commit to anything.
So it's not as simple as just looking at the price tag of the surgery itself.
Right.
You really need to consider that whole package.
A whole package.
This might be a good time to bring up insurance.
Yeah.
Does typical health insurance even cover?
That's where it gets a little tricky. Traditional health insurance plans often don't cover medical tourism.
Oh, right.
However, there are specialized insurance policies that are specifically designed for international medical travel.
Got it. So that's something to really research thoroughly. You don't want to be stuck with some huge bill if something unexpected happens.
Exactly.
I can't help but think about the ethical implications of medical tourism.
Right.
Is there any concern about it impacting healthcare access for the local population?
It's a valid concern. The influx of medical tourists could potentially strain resources, especially in areas where the healthcare infrastructure is already stretched pretty thin.
So how can someone who is considering medical tourism in India ensure that they're not contributing to that problem?
It's about being a responsible medical tourist.
Okay.
Choosing hospitals that are known for ethical practices, perhaps those with outreach programs that benefit the local community.
Right.
Maybe even incorporate some volunteer work into your trip.
That's a good idea.
If you can, it's about contributing positively.
Yeah.
And not just taking advantage of the lower cost.
Like a great point. It's not just about personal gain.
Right.
It's also about being mindful of that broader impact.
Absolutely.
So let's shift gears a little bit here and talk about the role of technology in all of this.
Yeah.
The script mentions how online platforms are making it easier to find and book these treatments abroad. But how reliable are those platforms?
That's a great question. Technology is definitely playing a huge role in this rise of medical tourism.
Okay.
You can find information on hospitals, doctors' costs.
Yeah.
You can even book consultations all online.
Right.
But as with anything online, you got to be cautious.
So how do you separate the legitimate platforms from the ones that might not be so trustworthy?
Look for accreditation and certifications from reputable organizations. Read reviews not just on their own site, but on independent platforms as well.
Okay.
Transparency is key.
Yeah.
If a website is vague about the costs or their affiliations, that's a red flag.
So do your homework.
Yeah.
Don't just assume that because a website looks fancy and nice that it's a reliable source of information.
Absolutely.
Now, while we're talking about technology, I'm kind of curious about telemedicine. Is that something that factors into this at all?
Absolutely. Telemedicine is revolutionizing healthcare.
Okay.
Including medical tourism.
Okay.
You can have virtual consultations with specialists in India before you even book a flight.
Okay.
This allows you to discuss your case, get a preliminary assessment, and even just get a sense of, is traveling for this treatment the right choice for me?
That's incredible.
Yeah.
It takes away some of that uncertainty and that risk. You can have those initial conversations.
Right.
You can get a feel for the doctor, all from the comfort of your own home.
And it goes beyond just those initial consultations.
Oh, wow.
Some hospitals in India even offer remote monitoring systems.
Okay.
Imagine having your post-op recovery monitored by your doctor in India, even after you've returned home.
That's, like, futuristic.
It is pretty futuristic.
But also really reassuring, knowing that you're still connected to your healthcare team, even across continents.
Exactly.
It really highlights how technology is, like, changing the whole landscape of healthcare.
Breaking down those geographical barriers.
Yeah.
And it's giving people access to a wider range of healthcare options than ever before.
Whatever before.
But it's really important to remember, technology is a tool.
Right.
It's not a replacement for thorough research, personalized medical advice, and careful consideration of all the factors involved.
Right. That's such an important reminder.
It is.
Now, with all this talk about modern technology, I want to circle back to India's ancient traditions for a second.
Okay.
The script barely touches on mental health.
Right.
But I know that India has like a rich history in that area as well.
Oh, absolutely. India's approach to mental health and well-being is deeply rooted in this ancient wisdom, particularly practices like yoga, meditation, and Ayurveda.
So I'm imagining a scenario where someone travels to India, not just for like a physical ailment, but to address maybe their stress or anxiety or even burnout.
Yeah.
Is that something that people actually do?
It's becoming increasingly popular.
Really?
People are really seeking out those ancient practices, those holistic approaches to mental well-being that India is so well known for.
So it's not just about like fixing a broken bone.
Exactly.
Or having surgery.
It's about addressing that whole person, mind and body.
Mind, body.
And it's really fascinating to see how these ancient practices are now being integrated with modern mental health care approaches all over the world. You know, mindfulness-based therapies, yoga meditation, they're gaining recognition as valuable tools for improving mental well-being.
It's like bridging the gap between ancient wisdom and modern science.
And India is really at the forefront of this integrative approach to mental health, combining the best of both worlds.
It's pretty amazing how India offers this whole spectrum of healthcare. From, you know, those cutting-edge surgical procedures to those ancient practices for mental well-being. Talk about a holistic approach.
It really is.
But with all these options, I imagine it must be kind of overwhelming.
Oh, absolutely.
For someone who is trying to decide, like, is this right for me?
Yeah.
Is medical tourism in India right for me?
Yeah, it's definitely not a decision to be taken lightly. There's a lot to consider, a lot of research to do. It's not just about finding the cheapest option. It's about finding the best fit for your needs and circumstances.
Where should someone even begin with this?
Okay.
Like, what are the first steps?
I would say start with a conversation with your primary care physician.
Okay.
Discuss your health concerns. Explore all the options that are available to you, both locally and internationally. Your doctor can really help you assess those risks and benefits and guide you towards making a really informed decision.
It's not about, like, bypassing your current healthcare provider. It's about kind of expanding your horizons.
Exactly.
And seeing what else is out there.
Yeah, and once you've had that conversation, then you can start researching.
Okay.
You can look into specialized medical tourism agencies, explore those online platforms, read reviews from other patients. The more informed you are, the better
equipped you'll be to make the right decision.
Exactly.
And I imagine this research goes beyond just finding a hospital and finding a doctor.
Oh, for sure.
It's about understanding that whole process.
Yes.
The logistics, the potential challenges.
Absolutely. It's about understanding the visa requirements, travel arrangements, accommodation options, and even just like those cultural nuances of the place that you're traveling to.
It's about having like a really comprehensive plan.
Yes, a comprehensive plan.
In place.
Yeah.
So it's not just about the medical procedure itself. It's about like the whole journey.
The whole journey.
It's about being prepared physically and mentally.
Absolutely.
For what could be a really life-changing experience.
It's about approaching medical tourism, not as a quick fix, but as an opportunity for transformation, for healing, for growth.
Wow.
It's about embracing the unknown and venturing beyond those familiar boundaries.
I feel like we've covered a lot of ground today. We talked about cost savings, expert care, ancient traditions, technological advancements.
Yeah.
It's clear that medical tourism in India is this really multifaceted and kind of evolving landscape.
It's a landscape worth exploring, worth understanding, worth considering as part of this global healthcare conversation.
So as we wrap up this deep dive, we leave you with this thought.
Okay.
What are your healthcare priorities? And could exploring options beyond your borders be a path towards achieving those priorities?
That's the question.
It's definitely something to think about as we navigate this increasingly interconnected world.
Absolutely.
Where, the pursuit of health and well-being really transcends geographical boundaries.